here in college. And as usual, today we have a scientific meeting in English. And in our program today, we have 3 presentations. And the first one that's the lid wiper epitheliopathy, presented by Dr. Nguyễn Thị Thúy Hằng. And the second one that is a paper review is the Association of Cataract Surgery and Risks of Diabetic Retinopathy. And it will be presented by Dr. Đoàn Thị Hoa. And the last one, I think it's in Vietnamese, not in English. And its name is Update of the Latest Technology in Refractive Surgery. And now we start with the first presentation. So welcome Dr. Nguyễn Thị Thúy Hằng with the presentation, the lid wiper epitheliopathy. Welcome, Dr.
Thank you. Good afternoon, dear Professor Nguyễn Xuân Hiệp and colleagues. Today, on behalf of cornea department, I would like to present a concept of lid wiper epitheliopathy. Have you ever known about the concept of lid wiper epitheliopathy? I think many people here today know about this, but today I want to talk about it more clearly and more detail. Firstly, I want to mention about what is lid wiper epitheliopathy. As we know, blinking and eyelid movement has played important roles in distribution of tear film and maintenance of the ocular surface integrity. The tear film provides optical clarity and protection to the eye. So, what area of the eyelid is responsible for spreading tear film during the blink cycle? So, some authors have mentioned about the mechanisms of the blinking cycle here. The first one is the patient. He is the first author to mention about the portion of the marginal conjunctiva of the upper eyelid contact with the ocular surface. And author Eyelid in 1965 also mentioned about the wrapping effect of the localized part of the upper eyelid on the purpose ocular. And author Kissing also report the contact of the upper eyelid with the ocular surface. And about the mechanisms correlate to the blink related to the micro chamber, also mentioned in the study of the chair. But until the 2002, by the author Carl et al., he is the first author who mentioned about the definition officially of the term lid wiper epitheliopathy. It means that it's a localized portion of the marginal conjunctiva of the upper eyelid. It has a role in the wrapping mechanism because it spreads the tear film over the ocular surface or over the surface of the contact lens. And lid wiper epitheliopathy, it means that epithelium is disturbed due to the friction into the microchamber. And the tear film minimizes the friction during the blinking by acting as viscosity lubricant. So it will cover the irregularities of the ocular surface. According to the author Carl, if the tear film is thin or unstable, or contact lens surface does not provide a stable or wettable tear film, this will cause the mechanical or functional effect on the lid wiper during blinking cycle. I want to mention about the anatomy of the lid wiper to let you all know about it clearly. Firstly, the lid wiper is a specialized zone located at the conjunctival side of the inner lid and the upper and lower eyelid. And it represents the region most closely opposed to the growth and the closest cells are located in the both superficial and deeper layers of the epithelium. And global cells, it has a role in secret mucins onto the lid wiper surface and it was also reported it has played an important role in the tear film stability. So it means that the lip wiper and ocular surface are separated by the loose film consisting of mucin and aqueous components. Here some pictures, you can see it, the position of the lip wiper in the inner of the upper eyelid and also in the lower eyelid also. And here is the way we can examine the lip wiper. In the picture you can see it. If we stand it with some standing approaches like rose bangle, fluorescein and rhythmic green, we can see that the horizontal length of the lip wiper from the superior punctum to the lateral canthus and the width of the lip wiper from the line of mouth to the subtarsal fold. Here is the image of the fluorescein and rhythmic green. And here's the picture of the moderate and severe stage of lip wiper epitheliopathy in the upper eyelid. About the rating of the severity of the staining, the author Croft mentioned in the 2002 about the rating of the lip wiper epitheliopathy. It was determined by the horizontal length and sagittal width of the rhythmic green staining. It has the grade from 0 to 3. When you stain the upper eyelid with the rhythmic green, you can see if the first picture is about the grade 1. The right side is about the upper eyelid and the left side is the lower eyelid. And you can see it with the different grade from 0 to the from 0 to 3. Here another picture showing the examination for the grading severity. About the pathology of the lip wiper epitheliopathy, we all know that the structural changes of lip wiper epitheliopathy cell with the atypical characteristics increase in the number and extent from the line of mouth. And the fractal dimension of the lip wiper microvascular network is also the second pathology is mentioned here by the Dr. Wang et al. In 2015. He mentioned about the vascular network in the contact lens, whereas appear to be loose compared to the healthy subjects. It means that lens-induced surface damage of the lip wiper will be increased, and the functional changes show there is a greater density of the nerve ending in the lip margin area. It means that it will increase the sensitivity in the lip wiper. And all the changes in the ocular surface sensitivities during the contact lens wear, it may cause possible factors with the metabolic disorders caused by lens-induced hypoxia and neural adaptation to mechanical stimulation, neutral sensitization in response to inflammation or hyperosmolarity. And about the etiology. The first one I want to mention here is the French frost. It also the important factors with the presence of the lens, contact lens will alter the normal structure of the ocular surface. It will cause a physical trauma and medical abrasion to the epithelial cells of the lip wiper. And Dr. Nance and Zhang in 1995 mentioned about blinking with the contact lens will cause impact, comfort the contact lens. In the theory of geopology, the principle is the principle of functions, lubricant, and the wear of the contact lens. The first one is about the relationship relationship between the coefficients of friction, load, relative and spread, and rubiceous fluid properties in the particular viscosity. And the second one is mentioned about the epithelial cells of the eyelid and the growth are subject to the friction during the blinking. This means that if we create a barrier, lubricants must apply to the lip margin zone. And the last one is about the mentioned by numerous authors about the telia, the lip wiper cornea interface based on the theoretical considerations. And the relationship between the coefficient of friction load relatives and the tear film will increase the friction between the lip wiper and ocular contact lens surface due to the inadequate lubricant, insufficient mucins, and tear hyperosmolarity. And other factors. It's also about the daily insertion of the fully hydrated lenses after many hours of contact lens wear. About the relationship with contact lens, we can see that a rectal tear film instability is noted with the contact lens wear, and the lip wiper epitheliopathy was associated with the tear volume, but not tear meniscus height in the study of the best et al. And this study suggests the role in decreasing friction and along the lower lip margin. And the relationship between the increased contact lens coefficients of friction and increased contact lens is comfort and corneal staining. Lip wiper epitheliopathy can develop shortly after individuals start wearing contact lens. It also mentioned in a study. And conjunctival tears, surgical suture on ocular surface, also experience the lip wiper epitheliopathy. They all mentioned about the importance of regular ocular surface to promote smooth and lubricous contact lenses between the contact between the ocular surface and the lip wiper. According to the outer curve in 2002, there was a 80% lip wiper epitheliopathy prevalence in symptomatic contact lens user, and the last is about and the former is about 13% prevalence in asymptomatic contact lens user. So it means that this disease can increase symptoms in contact lens wearers. Contact lens will further increase the friction between the region of the upper eyelid that contact the growth during the blinking and ocular surface. And some studies also mentioned about the significant impact of contact lens and on tear film stability. Irregularity of the lens characteristic and the physical presence of the contact lens in the tear film, it means that it will reduce the corneal sensitivity and accelerate evaporation, disruption tear film stability. Here is a slide to report about the relationship with the dry eye. According to Koch, they conduct a study of non-contact lens wearer having a symptom but not signs of dry eye. They also examine patients with normal fluorescein breakup time and symbol test values, and they show that action of the fluorescein corneal staining. It means that in the patient with the symptom but not with the signs of clinical dry eye examination, they can find the statistically significant difference. It means that lip wiper epitheliopathy will show in about 76% of the symptomatic patients and 12% of asymptomatic patients. And in symptomatic patients, the result of the dry eye test totally normal in this study. Therefore, lid wiper epitheliopathy may be the cause of the dry eye symptom in patients with normal fluorescein breakup time and simultaneous results. And adequate staining of the tear film and evaluation of marginal conjunctiva after lid avulsion are essential in examination. Here is some treatment. The choice of strategies for the treatment of lid wiper epitheliopathy is the link between the disease and ocular comfort. The first one we should use is the lubricant eye drop, and second one is maybe corticosteroid, because according to some author claim that the effectiveness of the corticosteroid for the initial treatment of this disease is will minimize the signs and symptoms. And basic fibrosis growth factors also so effective in treating this disease, according to some authors in 2011. We can also use brontoblast to reduce the symptoms. And another treatment is fit contact lens of high surface lubricity. After lens wearing modalities will reduce the lens wearing time, increase lens replacement frequency, and change lens material. All of this is also mentioned here, can improve the symptoms. And the last one, maybe we can improve the central blinking behavior of the patient by instructing them to how to blinking, not to switch an eye so strongly. Here's some conclusion in my presentation. The first one is about the diagnosis of lid wiper epitheliopathy may explain some symptomatic patients with no other clinical findings. This means that this disease will contribute to dry eye symptom and ocular space irregularities. And we can also learn more about the role that in place in contact lens discomfort. It means that we should examine lid wiper epitheliopathy during the clinical examination. And any interventions that can help contact lens wearer will show some benefits for successful practice. And we should pay attention to the microtrauma because of the bad blinking behavior in the patient with a low lubricious ocular surface, because it will exacerbate the dry eye symptom and contact lens wearer. And we should pay close attention to the anatomy around the lid margins and the lid wiper. And the last one is about this disease needs further in-depth investigation to get higher patient satisfaction. Thank you for your listening.
Thank you very much, Dr. Han, for your presentation. So, Dr. Han just describes one kind of conjunctival disease. So, we are talking about the disease of conjunctiva, of the skin, and blepharitis. And here, that lid wiper. Lid wiper is that one small area is located between mucosal structure and skin structure. And the pathology here is relating to some disease, and Dr. Han just described how we can recognize the disease and what is the etiology and how we can treat this kind of disease. So, is there any comment or question from the audience? Doctor? I'm sure that this is quite new disease for us. The disease exists for a long time, but we ignore that disease. And now people talk more and more. It's the same like a dry eye before. The disease exists, but we did not recognize the disease and we did not pay attention about the disease. So Professor Kung, you want to add some comment or some questions?
Thank you very much, Dr. Tang. On behalf of the doctor in the content department to present a very, I think, good topic. The purpose to be presented this topic because it is not severe conditions, but it is easy to overlook when you present patients. And first of all, when patient came to see us, and we have irritation, and patient have a dry eye, but when we do some tests, but it don't show the side of the dry eye, so we have to think about the lid wiper. And this condition, I think, is associated with closely to the people who wear contact lens. And now there are more and more people who wear contact lens, so I think this disease will be more common. So I think Dr. Han will have quite comprehensive about this disease. So I think I know that Dr. Chi, the doctor in our department, will have important research about this disease, and there is outcome of this her research was published in the journal of ophthalmology. So Dr. Chi, could you share with us some outcome of your research?
So Dr. Chi, could you please move up? And you can talk more about the disease so we can learn more about that. Yes, please. Dr. Chi spent 5 years in Japan and for her PhD, and the topic concentrates on the dry eye. So I'm sure she has many knowledge about this one. So please.
Yes. As Dr. Kung has mentioned before, this condition is often overlooked, and for dry eye specialists, this condition is not uncommon. And in my study published 3 years ago, the result has found that there are a close relationship between lid wiper epitheliopathy and the severity of dry eye. And I will comment a little bit about this condition and why it's important to in management of dry eye, because it's widely known that there are discrepancy between the subjective symptoms and the clinical signs. And this condition has the potential to bring the gap between what we see and what the patient feels. And yes, so in my daily practice, I always look for this condition, but the difficulty is that glycemic green is not available everywhere. So, and in order to diagnose this condition, we should use glycemic green, or there are another technique that we could use with only resin, but we need to have a slit lamp with a yellow filter. So, yeah, that's all.
You still have many things to say, yes? So, any question or any comment from the doctor? So, I'd like to ask Dr. Chi, Professor Kung, and Dr. Hang. So, when we examine the patient, and we recognize that the patient has a lid wiper neutropathy, what does it mean? It means that the patient has dry eye. It means that the patient has a contact lens complication.